Microbiome, I have to say, I just think it's totally fascinating from the perspective of a neurologist and neuroimmunologist, because if you think about it, our body is composed of half of human cells, so 50% are human cells and 50% are microbial cells, right? So this is a tremendous mass. And if we look at the amount of genetic material that comes from these microbes, it's more than 99% of our genetic material. So this already shows that there's enormous biomass and genetic material that these microbes bring to us that, of course, interact with our immune system, both in health and disease. And specifically now in neuroimmunology, the question is, what do bacteria that sit far away from the brain interact with the brain? And the pivotal work really has been done in mouse studies from Hartmut Beckerle in Munich, right, where they saw that if you have mice that don't have microbiota, they're basically resistant to MS, which then sparked the whole field also of translational research to say, well, what does this tell us about an MS patients? And so the contribution I started this as a postdoctoral fellow in Sergio Baronzini's lab before then, now starting my own group, is to ask the question, how are microbiota and MS patients different? And this has been really facilitated by the technological advancement that we can now quite cheaply and with high throughput measures, sequence stool samples which have the gut microbiomes in MS patients and compare this to healthy controls. And what the past years have learned is that it's very important to choose the controls widely, because they're not just factors like MS diagnosis that impact the microbiome, but of course also other environmental factors. Let's say, you eat your diet, you're vegetarian and you have a cat at home, that already influences your microbiome. So the way we set up these microbiome studies is we have an MS patient and we usually ask the healthy household control to contribute a sample as a control, because they're not genetically related, so we don't have the genetic impact. And we can control for the household because usually they share the same environment and even food habits. So then we can really have a more specific differences that is potentially linked to the disease rather than confounders, which we always have in microbiome studies. And then there's, of course, pre and post analytics that complicates the work. So where we currently stand is that we know that the microbiota in MS patients are different from healthy controls. We know this from those studies, but also from twin studies where, one twin has MS and the other one doesn't. And of course, now, where I think the biggest piece of work for us to be done is to really understand the mechanisms on how differences in microbiota translate, or what do they have to do with neuroinflammation. And of course, there are several possibilities of how differences in microbiota affect neuroinflammation. And specifically, we are interested in understanding how this works through the interaction of microbiota with the immune system. You could also think that there's microbial translocation and bacteria secrete things. So there's a lot of possible pathways. There's also the vagus nerve, which is the direct nerval route between the gut and the brain. But my group is specifically interested in understanding how microbiota, through interaction with the immune system, affect neuroinflammation. And there are really two pieces to it that we are specifically interested. The first one is the work that I started at UCSF, is the question how microbiota interact with B cells in MS, so a certain subtype of immune cells. And by that work, we actually discovered a very surprising, unexpected mechanism, and that is that we all harbor so-called IgA-producing cells. And as I said, this is really what also prompted our IgA work in the field of autoantibodies, that we all have IgA-producing cells in our gut. And it's known that these cells have a regulatory role. They're important for gut homeostasis, and they secrete antibodies that make sure we are basically composed of the same microbiota every day. So these are very important cells. And what we discovered in MS, that was totally unexpected, is that these cells can actually travel out of the gut during acute flare-ups of multiple sclerosis. And where do they travel? We found them in the brain. So we basically saw that there's a decrease of these cells in the gut, and we found them in the brain of patients with inflammatory activity. And of course, the question was what are these cells that usually have their home in the gut and all of us suddenly look for in the brain? And surprisingly, they are not, we didn't have any evidence that they're recognizing anything in the brain or contributing to maintaining the inflammation in the brain. Rather, what we found is that they're secreting antibodies that are microbial reactive, and that they are also secreting cytokines that are actually helping to resolve the inflammation. So taking together, we currently think that these cells, that our gut is an important reservoir of anti-inflammatory cells that travel to the brain to counteract inflammation, and the fact that they're microbial reactive also potentially points to their role in shielding the brain from low-grade microbial translocation, which is, of course, something discussed also in MS, that there's maybe leaky gut, and these cells also help to contain this from the brain. But, of course, there's much more work to be done, and this is, of course, one important part of my lab that we're interested in further characterizing these cells, what they're doing, but also seeing if we can potentially harness those cells therapeutically by triggering the egress from the gut and helping basically with expanding those cells, helping the body to resolve neuroinflammation. That's basically one part, which was unexpected because these cells are helpful. But then the other point is we see differences. So there must probably also something that's linked to the BAS, so the inflammatory part of multiple sclerosis. And there are different mechanisms how we currently think of microbiota contributing to maintaining inflammation in multiple sclerosis or in triggering. And that can be either by just shifting the balance of the immune system to a more pro-inflammatory state, or even by antigen-specific means. That means that there can be molecular mimicry. So microbes could potentially look like something in the brain, and then by chance, these microbes activate the immune cells that can cross-react with something in the brain by chance because the microbe have similarity. And so we are currently conducting work to address that, and that's unpublished work, but what we are have seen that most likely both of these mechanisms are taking place, and there's also published work that supports that most likely microbiota can shift the immune system in a beneficial or non-beneficial way. And we actually see microbiota in MS patients that are more prevalent in MS that can tip the balance towards a more pro-inflammatory state of the immune system, which means that could be, one potential mechanism of how they shift the balance of maybe an already autoimmune prone immune system towards reacting towards the brain. And the second mechanism is that we do have evidence that indeed molecular mimicry between microbiota that we find in MS patients, that means similarly of their sequence to brain proteins, might contribute to recruit immune cells from the immune repertoire that then cross-react. And of course, understanding this will then also eventually help us to think about treating strategies, how to resolve that, such as manipulating the microbiome through targeted intervention of giving certain microbes that have basically a beneficial effect of the immune system, or by eliminating the harmful bacteria in the gut. So I think there's a lot of potential to additionally use microbiota as a tool to reshape or reset our immune system in patients with MS, in addition to what we currently do that is directly acting on immune cells with the currently available disease-modifying therapies.